KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Kathy Novak. Mask recommendations are back in the Bay Area, and COVID is wreaking havoc on the Olympic Games in Japan. So with all of this going on, we thought it would be a great time to check in with someone who has been a trusted voice throughout the pandemic here in the Bay Area and beyond. That is the chair of the Department of Medicine at UCSF, Dr. Bob Wachter. Dr. Wachter, thanks so much for being here.
Hi, Kathy. Thanks for having me.
Well, it's only been a month or so since California got rid of the tier restriction system, lifted the mask mandate, and now we're being asked once again to put those masks back on, even if we are vaccinated. What's going on here? Did we reopen too soon?
I think we reopened at about the right point, but we didn't understand that this Delta variant was going to be quite as nasty as it's turned out to be. So it's easy to look back and say we shouldn't have, but I think the facts on the ground at the time were fine. We were doing okay. The case rates were remarkably low. The hospitals had almost no patients with COVID in them. But Delta has proved to be a pretty worthy foe. It's about twice as good at its job of infecting people as the original virus, and that makes it harder. Cases are going up, hospitalizations are starting to go up, so we have to adapt just as the virus adapts.
And in particular, good at infecting non-vaccinated people. And there are really good vaccination rates here in the Bay Area. So people who are fully vaccinated, how safe should they feel about going about their business given the Delta variant? Is this new mask recommendation really about community protection?
It's a little bit about two things. It's about protecting the community. It's also about protecting yourself. So, for example, even before the mandate or the recommendation, I had started again to wear masks, actually double masks, when I went inside to shop or other indoor spaces, unless I was entirely confident that everybody around me was vaccinated. And the reasons for that really were twofold. One is, even though I'm fully vaccinated and therefore pretty confident that I'm not going to get super sick and die, I still don't want to get COVID. And the reason is I can't say for 100% case of COVID in a vaccinated person won't turn into long COVID. I'm 63, so I'm at slightly higher than average risk. And there are some people that do get very sick. And so I don't particularly want to get it. But just as importantly, because the Delta variant is more infectious, there is a chance that I could get it, have a mild case, but carry it and give it to a kid, give it to an immunosuppressed person, or give it to an unvaccinated person. So overall, and I'd have to say wearing a mask doesn't bother me that much if I'm in the Safeway or Whole Foods or something. So it feels like it's prudent at this point, with much more virus in the air than there was a month or two ago, for everybody to start wearing masks again. And I know it feels like we're going backwards, and none of us wants to do it, but unfortunately, this virus doesn't really care what we want. It's going to do what it does, and we've got to respond appropriately.
And do we need to start to think differently about herd immunity? We never really knew where the numbers were early in the pandemic, and now given the Delta variant, are we at a stage now where basically all of the adults have to be vaccinated, and before we get to a point where more kids can get the shots?
Well, this concept of herd immunity has been elusive. We've talked about it for a long time, and it often has this sort of magical element that, like, when we hit that number, somebody rings a gong and all of a sudden COVID is out of our lives. And it was never going to be quite like that. It's really a matter of degree. In the Bay Area, let's take San Francisco as an example, about 70% of all San Francisco residents are now fully vaccinated. So that's terrific. If we were dealing with the original virus, it probably would be high enough so that the pressure on cases would be sufficient that we would see very little community spread. What we're seeing, though, with 70% of all San Franciscans being vaccinated, we've seen cases in the city go in about a month ago up to about 85 a day today. And so it's clear that even with 70% of people fully vaccinated, that's not enough to achieve herd immunity. If by herd immunity we mean that there's so many people who are immune that the virus just has no room to gain purchase. So what is that number where the virus would stay super low at super low levels? even if everybody took their masks off and went back to living like 2019, it's probably going to turn out to be more like 80 or 90%. And it's going to be awfully hard to reach that unless more people get vaccinated and we can start vaccinating all of the children. So I think for now, we have to assume that we've not reached herd immunity, even in the most vaccinated city in the country, San Francisco, and therefore we have to take more precautions than any of us would like.
And where are we up to on booster shots? Do we need to be thinking about getting them, particularly those people who got the single shot J&J? Should they be getting another shot of an mRNA vaccine?
I think boosters are going to be in all of our future at some point, but it's going to be staggered as to who needs them. Right now, they are not recommended by the CDC and the FDA for anyone. But I guess if I had to take out my crystal ball, I would say that they will be recommended for people who are immunocompromised, for whom the 2 shots of Pfizer, Moderna, or the single shot of J&J. There's good evidence that a 3rd shot or a 2nd shot in the case of J&J can boost your immunity and make a big difference. I think it's probably going to turn out to be that people who got J&J, the single J&J shot, that the level of immunity may not be high enough in the face of Delta, and that they may benefit from a 2nd shot, and it would be an mRNA shot. It would be a Pfizer or Moderna shot on top of their J&J. The feds have not made a recommendation on that yet, but I'd be watching that carefully and talking to your doctor. And I certainly know people who got the J&J who have gotten the 2nd booster shot. As for the rest of us, I can imagine that there will ultimately be a recommendation that older folks, maybe over 70 or over 80, get a booster because their level of immunity that they get from the vaccines is lower. It may be that we start seeing recommendations for boosters in people who got their shots a long time ago. The impact of the vaccination hasn't really started to wane yet, but we're only 6 months into widespread vaccination. So it won't be shocking if folks like me who got their vaccines in December and January, we start seeing more infections as we get to be a year out. So I think you have to stay tuned. I think everybody should be prepared for needing an extra shot somewhere along the line. But right now, I'd say the groups I'm most worried about are the immunocompromised patients and maybe the older people who got a J&J shot.
The vaccines are plentiful, it seems, though, here for people who do want them. And the problem is largely getting through to the people who don't. Do you think we're edging more towards a stage where we'll be mandating vaccines?
I hope so. I wished, because obviously the politics of mandating are hard and there's going to be a lot of pushback. And so it would have been great if we didn't need to mandate vaccines. I have to say I'm a little bit shocked that we are finding ourselves in the position when the evidence on the vaccines is they are remarkably effective and remarkably safe. I would have thought that people would do it out of their own self-interest and the interest of their community. But the fact that we still are seeing 30 or 40, in some places 50 or 60% of people choosing not to get a vaccine, I do think we're going to have to become a little bit more about it. Certainly in settings where you have a lot of vulnerable people around, I think it's essentially a no-brainer. And so, for example, at UCSF, the vast, vast majority of our employees are vaccinated, but there are other healthcare organizations where that is not true. There's data from some nursing homes where 50% of the staff are not vaccinated. To me, that's immoral. And our first obligation is to keep our patients safe. So I was actually quite pleased that the University of California has mandated that all of us, students, faculty, and staff at all of the UC hospitals, and in fact, all the University of California, get vaccinated in the next month or two. Some people say we need to wait until the full approval from the FDA. I don't believe that. I think the evidence is crystal clear. The vaccines have now been out for about a year. The evidence is crystal clear that they are safe and remarkably effective. And I think in settings where you're going to be around vulnerable people, whether it's in a hospital or a nursing home, or frankly in a school where you're going to be teaching kids who can't get vaccinated, I think it's perfectly reasonable to mandate vaccination.
Dr. Wachter, always great to get your insights. Thanks so much for joining us.
My pleasure. Thanks for having me.
Dr. Bob Wachter is the chair of the Department of Medicine at UCSF, and I'm Kathy Novak. Thanks so much for tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 at AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.